Many thanks for joining us again on TVC Breakfast. Let's talk health, and specifically this month of September is the Childhood Cancer Awareness Month worldwide, serving as a reminder of the devastating impact of cancer on children and their families. Childhood cancer or pediatric cancer encompasses various types of cancer affecting children and adolescents under the age of 19. But early detection can be challenging as symptoms often mimic those of more common illnesses or injuries. And the common forms of childhood cancer include leukemia, brain and spinal cord tumors, nerve tissue cancer, as well as kidney cancer. And as a nation, it's our collective responsibility to prioritize support for children who are bravely fighting this disease, that's cancer. And so we have joining us now in the studio to share valuable insights and expert knowledge on this critical topic, Nursing Service Manager Belonda Michelle Mangongolo. Thank you very much for joining us.
Good morning.
I hope I did well. She's a South African, by the way, and if you follow the narrative, in that build-up to the conversation, we talked about a national duty, so to speak. But here you are, you've been here in Nigeria for about 5 years. What's it been, managing this disease, the children who have these diseases, what's it been like from your insights?
Thank you very much. This is a wonderful question, and good morning, everyone. Yeah, I'm very, very grateful and privileged to be here this morning. When we see, first of all, the topic itself, childhood cancer awareness is a very, very interesting topic to discuss, and we've got so many things to speak about. So the point that I want to raise this morning, I want to speak on a incidence rate in Nigeria for cancer in children. And number two is going to be the access to care or to specialized oncology services. And in the third place, I want to speak about survival rate. So just very, very important point that you will have to discuss about. So now to come and say, how do we come about treating these children in Nigeria or national priority? It is indeed a national priority, and everywhere in the world. And as we are talking about Nigeria now, we can say, what are the things that, or challenges that can hinder us to reach the point or to close that gap? Because we don't want any child to die from cancer anymore. So we want to make sure and stand in that gap to close it by bringing more education and awareness to parents, because this is what seems to be lacking. Parents are not aware, or they've got the information, but that information is limited about the cancer for them to be able to detect the first signs and symptoms in the children.
Right.
And, just in our intro, we also, mentioned the fact that not just access to care, that before that, identifying some of these symptoms, you've also mentioned that, which also mimics some other illnesses. So to the second leg of what you are saying as regards, identifying some of the symptoms in the first place before we even talk about care, what are some of the symptoms in children, and how do they really mimic other illnesses that children have at that age?
Thank you very much for this wonderful question. Every mother or every parent should be the first physician in their house. So you know your children, you know how they behave. And the moment you begin to see some strange behaviors in the kid, some symptoms that you don't used to see in that kid, you have to open your eye. It depends on the cancer that the kid can have, but when we want to talk on the common signs, you can just see this kid is just tired, just sleeping all the time, does not want to play with other children, and they might be complaining over, I've got pain here, pain there, or you begin to see their masses in the body, or the swelling in the tummy or the eyes. You have to say something is wrong here. And when you go, you take that kid to the physician, and after 2 weeks or a month, you have to take that kid again to the same physician with the same problem. It keep coming back. You have to, it is an alarm. You have to go for a second opinion. Why is this child? We are treating infection, but it's forever. We've been treating malaria, especially we can see in everyone, as I said, every mother is a doctor at home, but what we do when the kid is sick, we think it's malaria. The first thing that comes to mind is malaria. So we want to treat malaria for everyone, for even in adult, without going for deep investigation. Is that what is lacking in parent?
Okay, so that is one step that you believe needs to be addressed in
Yes.
the country. So let's also look at the existing healthcare facilities in Nigeria vis-a-vis the survival rates, you know, of these childhood cancers. What are your thoughts?
Well, thank you again. The survival or the incidence, and it's on the high side. The survival rate is I can say poor, but we are working on it. We are coming. This is why we want to stand for that mother. We want them to step up. Every mother, every parent should step up until we bring it down.
And by stepping up, is it through the route of early detection, or you know, what specific?
Awareness and education. Because if we educate the parent and we make them to understand what are the signs that, as I said, if you begin to suspect something, wake up. Don't just say this is malaria or this one is tired because yesterday you went for soccer, things like this. They are tired. No, go to the hospital. Let them investigate, and they can still find something that is abnormal in that kid.
And in terms of, you know, what you've mentioned, most person just deciding that it is malaria, possibly because of the financial implication or the financial burden that this may have on families. But for this situation, what's the financial, you know, scope? I just want to understand what it's like, the burden on the parents, and also the emotional aspect in the hospital.
Yeah, you know, let me say this. When we are treating cancer patients, including children, we are giving them what you call holistic care. We don't want to look at the disease alone because we are treating an all human being. That person is an emotional being, is a financial being, is a mental being, spiritual being, physical being. So when the cancer treatment are very, very expensive, everywhere in the world, not only in Nigeria, it's very, very. And here, most of them need to pay out of the pocket. So this is a major challenge that parents have. Even if they go to the hospital, after that deep investigation, they discover that there's something abnormal, then we still have that misconception of the cancer itself, even the cause or risk factors for the cancer in children, even in adults. So we still have that misconception again, even on the treatment. And this is going to bring the fear and the shame that comes with the disease. So sometimes we don't want to open up that my child has got cancer or I've got cancer. We seem to sweep it under the carpet, to cover it. And then we prefer, because we don't have money, we want to go to the herbalist or we want to go to church. If we can get the cure for that.
Right. And okay, earlier on, I also asked about, you know, the existing government, you know, support, because you just said now that many of these payments, these expenses are borne from out of pocket of the families concerned. And you also said that, you know, you're working on bridging that gap. Can you tell us how you want to, you know, go about this? Are you also advocating for full government support, or are there some other interventions that you feel can be done?
Yes, very much. Thank you very much. We are advocating. We will not stop advocating for these children. As I said, we don't want them to die from cancer. So we are knocking at the doors, and for the government to open the doors for us. And we have got some of our non-profitable organization that we call ONG that are also in support for the children. And we still send a call or an invitation to more people to come. If you want to donate, please, you are more than welcome, because we want to save the future of tomorrow in these people, the children.
And in terms of, you know, the issue of stigma, it's an issue I want to actually stay on. What advice or, you know, resources do you expect parents to have, should, you know, equip themselves with, especially when they find themselves in this situation? So many persons may want to keep quiet about it because, like you said, the kind of, you know, shame or disgrace that they actually feel may not actually be true in that sense. But when you get this diagnosis, what should the parents do?
That's why we are here. We want to give the support and to let them understand that it is not the end of life. It is not a death sentence. Just come out. be bold, stand for that child, because that child is also looking at you. Whatever, you can see every children or children in hospital, when the doctor is coming for diagnosis, they don't even want the children to know that they've got cancer. So the doctor and the parent will just go and speak in the corner. And that kid is saying, you are playing a bad role on the mind of that kid, because she's suspecting, or he's suspecting something. Why are they not discussing here?
So they should be open.
Yes. Just bring that information to the level of that kid. Let them understand what is going on, and just let them that we are fighting, and we make sure we win this, and we are going to win, especially if it was early, if we could detect it very early. Yeah. We don't need to cover, bring that information to the kid. Tell the mother there's nothing to be ashamed of. There's no stigma about this. You did not go to look for it. Remember, there's no cause for cancer. So it can happen to anyone. Just open up. Open up. You can see even in adult, people say, I don't want anybody to know that I've got this. Never disclose it.
Even though people will say, well, that is, it's my right to privacy and all of that. But let's also look at the issue of training. Nigeria, many Nigerians will tell you that there is a major deficit of healthcare professionals, and for a disease as I don't want to use the word devastating, but for a disease as a childhood cancer, I wonder where the issue of training fits in. How well trained are the professionals? Do we even have enough of them? And in terms of number, how is it a formidable number of patients that we are dealing with in Nigeria? Do you catch my
Yeah, thank you. I understand. We have got a large population. That's number one. And in terms of healthcare professionals, unfortunately, you maybe we can stop it tomorrow, but all of them are going outside. They're leaving the country, and they prefer to go and work outside. So this can be the challenge in this regard. But
okay, and how are you making up, despite the shortfall? How are you?
They're remaining, because it's not everybody that is going. There are those who are staying behind for their country. And those are the ones that you will work with. We make sure we empower them, and we stand in the gap.
Stand in the gap, right.
All right, so let's talk about, survivors. Are there any challenges that survivors face after, their years, after getting better, so to speak? And perhaps there is a rate of reoccurrence after this incident.
Yes, there are probabilities that the cancer might come back after being treated. So when we treat them, and when you win that battle for the first time, we call it remission. So that kid is in remission. It can be for 5 years, 8 years, 10 years. But there are some that they can PD or progressed after a few months or after a year or two. As I said from beginning, early detection, if you detect early and you bring an accurate diagnosis, bring a prompt treatment, I don't think you're going to lose that battle. The thing is when you begin to see them late.
Right. And then the role of NGOs, how well do you think, they are playing this role of advocacy and even helping to meet the gap in terms of funding, financing, and all the supports that, these warriors deserve? How well or how sufficient is the role of NGOs in Nigeria?
They are trying, everybody is trying, even the government itself, everyone is trying, but we just want to send that call to everyone. We cannot stop. Let's keep doing it. So you can just decide to donate a percentage of your income. It's more than welcome. Just say, I'm donating every month. I'm going to give, let's say, 1% of my income for the children. It's more than welcome.
And I see you work at the NSI Youth. This month is the Childhood Cancer Awareness Month. Are you doing anything for the children in the hospital presently?
Definitely, yeah, we are doing. Yeah.
What exactly are you doing? Can you enlighten us?
We are organizing a small party for them, and play therapy, let them just call it play. And it's very, very interesting. So play therapy, we play with them, and let them enjoy life, because they can still enjoy life. You can still put a smile on a child's face.
And the public is welcome?
Yes, they're more than welcome. Everybody's more than welcome.
All right. We thank you very much for speaking with us on the program. We indeed salute you and all the work that you're doing on, to help the plight of children living with cancer. Indeed, it's a tough one, but we really must give you kudos, you and the entire team, for all the work that you're doing. We've been speaking with a nursing service manager, Belonda Michelle Mangongolo. Thanks a lot for your time with us.
Thank you very much.